right, it's October and we're talking about breast cancer. We're taking your calls. We have experts here from the MedStar Health Cancer Network, and one of those experts, Emily Kuchinsky, a genetic counselor with the network. Tell us, Emily, how many of these cases are actually breast cancer by genetics diagnosed?
So actually only a small percentage, about 5 to 10% of breast cancer is inherited. So it's rare that breast cancer will be genetic. However, it's very important to identify these families because women who have a genetic risk factor have a significantly increased risk for breast cancer. Usually it's 5 times higher than the general population risk. So it's really important that we identify these families and follow them appropriately.
Now, when we talk about genetics, are we talking about the BRCA genes or no?
So the majority of women who have genetic breast cancer will have a mutation in either the BRCA1 or the BRCA2 gene. However, recent discoveries, we found that there's up to 24 different genes associated with genetic breast cancer. So it may be another gene. So it's important to meet with a genetic counselor or genetic professional to really see if they need just BRCA testing or may need more in-depth genetic testing.
Very scary. So you already know that it runs in your family history. What can you do? Because it's got to be very, very concerning. You know,
Yeah, I think the first thing that a person should do is talk to their healthcare provider about whether they meet the criteria for genetic counseling and get a referral for that. But in the meantime, they make sure they're doing their self-breast exams, their annual mammograms if they're 40 or above. Also, there's a lot of risk factors for breast cancer that we can't control, like our family history and our genes, but we can control things like our lifestyle, diet, exercise, which have been linked to increased risk for breast cancer. Being overweight or not eating a healthy diet has been linked. So it's important to at least try to focus on the things we can control about breast cancer, and then talk to the healthcare provider if you're concerned about genetics and see if you need a genetic assessment.
So now, if you have a family history, does that mean that maybe you should start those self-breast exams earlier or mammograms earlier?
So yes, that's part of what we do in genetic counseling is we determine who needs to start screening earlier. So a lot of times you'll start screening 10 years earlier than the earliest diagnosis of breast cancer in your family. So if your mom was diagnosed at 40, you may need to start your mammograms and screening at 30.
So if you find out that you are predisposed to breast cancer, what are some of your treatment options?
So if a woman who's at significantly increased risk for breast cancer has a couple different options. One would be increased surveillance, like we were just talking about, so starting mammograms earlier, also doing more frequent breast screening, like breast MRIs, which can be done annually, and they're usually spaced out 6 months from your mammogram, so that every 6 months you're either getting an MRI or a mammogram. And then another option, because those increased screening doesn't decrease your risk for breast cancer, it just allows for early detection. So some women who are at significantly increased risk may consider having a prophylactic or preventative mastectomy, so having their breasts removed before they even get cancer, which decreases their risk for breast cancer by over 90%. But there really isn't a right answer between those options, so it's really, talking to their healthcare providers, you know, finding out what the best decision is for them.
All right, Emily, thank you very much for coming in. Some great information. And again, we're taking your calls 410-481-2222 till 6 o'clock. So if you got questions, this is a great opportunity to get them answered. Why?